Telemedicine is an important alternative way for patients to access care, and Brown Emergency Medicine is launching a telemedicine option for patients who need the expertise of an emergency physician and don't want to travel to the hospital. You'll be able to speak to a board-certified emergency physician or pediatric emergency physician and get a full video visit and get that expertise. And in many cases, that can take care of the question that a patient or a parent has at 10 at night when they may be on the fence about going to the emergency department or not.
We transformed our outpatient service from what was traditionally a face-to-face experience to telehealth almost entirely. And that enabled our patients who had ongoing neurological issues to retain their relationship with their neurologist, continue to get therapy, and to continue to get managed throughout the COVID epidemic. For many of our patients, transportation and coming into the hospital is difficult, even under normal circumstances. And so the fact that we were able to continue to manage and provide care for our patients throughout this pandemic really was extraordinary. And we hope to be able to continue to offer different types of outpatient experiences for our patients in the future.
Our practice really had to change almost overnight. Very quickly had to basically discourage patients from coming to the office because those were the recommendations. We moved over a period of a few weeks to being almost entirely telemedicine. Interviews like this one would be turned into doctor appointments. The important thing was that we didn't want our patients to go without care. As we move forward, I think it's going to change our practice.
We've definitely been COVID ready for the entire pandemic. We've been seeing emergency cases throughout the past couple of months. We also have teledermatology in place for people who don't want to come into the office. We have that for some patients. But the most important thing is to come into the office because we are open, we are ready to safely see patients. There are definitely things that shouldn't be waiting. You do want to come in if you have something that's rapidly growing or changing. We do want to see that still in the dermatology office.
I think one of the most important things that we need patients to realize is that Brown physicians have been at the forefront of providing care throughout Rhode Island and southeastern Massachusetts for a long time. We're still providing the same surgical care to the patients of Rhode Island that we always have. We just had to change how we were doing it. We can do a lot of our post-operative visits and some preliminary pre-operative visits over the telephone or over the computer so that we could limit the amount of time that they needed to be in the office environment.
The model was you come into the office, you have your office visit, you have your procedure, and within a week, we turned around to at least 50% are now by televisits. We're able to get that up and running to maintain at least urgent care within the office for those that needed them. Patients who have to come in can come in, not sit in a waiting room full of other patients. I was quite pleased how well both the staff and the other physicians took on this new technology. I think it's going to change the paradigm going forward.